I'm like, what if the knee or the hip wasn't the issue? What if it was the foot and nobody assessed the foot? We replace a knee or a hip, but yet the foot is still biomechanically not perfect. Don't you think that could be a cause? And he's like, oh my God, I never thought of that. He's like, I've been doing this for 20 years and I've never thought about that concept. So now, in the past year, he does not do any knee surgery or hip surgery unless the foot is biomechanically sound.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Andreas Skounakis, who's an accomplished doctor of chiropractic with over 2 decades of expertise in patient care management, rehabilitation, and chiropractic adjustments. He is president of the Association of New Jersey Chiropractors, where he advocates for professional development, legislative advancements, and high standards of patient care. He is also passionate about functional movement analysis, sports injury rehabilitation, and the integration of evidence-based treatment approaches. So Dr. Andreas, welcome. I'm glad to have you here.
Daniel, thank you for having us. Thank you for having me. And I'm looking forward to having a great discussion about what we do.
Yeah, so let's dive right into it. How did you first get interested in chiropractic?
I was 12 years old. I played soccer all my life, and I had a severe hip injury. And I went through the whole medical route, MRIs, CAT scans, cortisone injections, PT, more injections. My father was seeing a chiropractor, and he recommended that I go see him. We went, we spoke for 25 minutes, and he basically assessed my mechanics, my gait. And it turned out that one of my hip flexors was a little bit tighter on my left than the right, and my actual joint was being compressed. So all he did was basically just pop my hip, and I was 100% after about 8 months of other care.
Wow, that's incredible. So, I mean, I guess that kind of inspired you to want to become a chiropractor yourself then, right?
That kind of sparked it in me, yes.
Okay. So now you also have some other businesses as well. I believe it's RFS Billing. Could you talk a little bit about that business also? Because
Yes.
I do want to come back to your chiropractic practice, but I want to talk a little bit about this other one first.
Yes. So it obviously goes hand in hand, but when I started my practice over 20 years ago, we did billing in-house, we outsourced it, and we saw that there was a lot of roadblocks and challenges that we were facing with billing and collections, and staying on top of everything, collecting all the necessary documents, paperwork. And there was a point where the company that I was using grew way too big, and they ended up selling the business overseas. And we noticed that there was issues with the amount of time that it took us to get reimbursed. But also, we were concerned because since our information is getting exposed to overseas third parties, we were not comfortable. So one of my buddies and I decided to start a billing company on our own, and as a hobby, essentially. And then it grew, and thankfully we have about 40 to 45 clients who are medical doctors, surgeons, orthopedists, chiropractors, physical therapists. So we've become educated on the entire healthcare model per se, and how everything works in the landscape of healthcare.
Got it. Now, you're also the president for the Association of New Jersey Chiropractors. So what caused you to want to get involved with the association, especially at the president level?
My family always says I have a gift of gab for whatever reason, and I don't know how true that is. I just enjoy talking to different people. There are a lot of changes in healthcare that are happening. They have been happening for years, but more so over the past decade, I think. The landscape has changed drastically. And I wanted to be more involved with the political arena to see what actually makes things happen. Again, it's a trickle-down effect. So I decided to run for the board. I got a board position, but that kind of inspired me. Just seeing, patients in my office, talking to other providers that I'm very close with. There was always challenges, whether a person needed an MRI or a CT or or anything, or surgery for that. And there was a lot of roadblocks. So I wanted to make a difference at the higher level. So I ran for the position with the current board, and I ended up getting in. And now I'm heavily involved with the political aspect of our state, which is great. I've met a lot of great people, a lot of great legislators, a lot of other presidents from other associations. And what's welcoming for me is that there's a lot of people that truly care about patients, and they care about the patient's health. Unfortunately, there's a lot of roadblocks in there. One of the biggest misconceptions I think that we all have, I know I did prior to me getting this involved, is, you want something, you ask for it, you get it. It takes years for something to pass, laws to pass, and, years more to actually start following the new legislations that come aboard.
Got it. Now, I do want to go to your chiropractic practice. Can you discuss some of the most common treatments that your patients come to you for, and why do you think they're so popular?
I remember, that's a great question, Daniel. I remember being in school, and one of my professors said, "You'll be surprised at what walks into your office." And I kind of always smirked at, every time I heard that comment, because I'm like, what are we going to see? Believe it or not, I see a lot of different non-conventional issues in my office, including, cancer. I see a lot of cancer in my office that we're basically I'm the first provider to inform the patient that they have it. I see a lot of sports injuries. I see a lot of injuries in youth. Lately, believe it or not, I see a lot of scoliosis that hasn't been picked up. Late teenagers that have it, always complaining of low back pain, neck pain, and they kind of, they go through the system. Oh, it's just growing pains. And, they lay on the table and you see a 20 degree curve on the thoracic spine, which actually consequently, causes other symptoms and pain syndromes actually. Sports injuries are the same, repetitive sports injuries. An athlete's playing, running, you always have that kid that always pulls a hamstring, and it's like, well, why does he always pull a hamstring? The kid stretches, he's eating well, he's an athlete, he should be pulling that same hamstring every year. And what I love doing, back to my Dr. Russo, who was my chiropractor, that's who inspired me. I tend to look at the cause. And when I look at the cause, it's basically from the foot all the way up into the kinetic chain. And we see a lot of, dysfunction in the lower extremity, which will contribute to some other injuries long-term. It's pretty fascinating. I love it. It's more physics than anything, I think.
Mm-hmm. So in what situations would you say what pain would you say that people who should come in to see a chiropractor who are not? Because I think when I think of a chiropractor, it's like, oh, I have back pain, I have neck pain. It's obvious. Okay, I see a chiropractor. You mentioned some of the other situations where it's maybe not so obvious, but what are the situations, pain points, conditions that you just wish more people would come in and see a chiropractor for?
Actually, we're discussing this at the board level now. One of the biggest misconceptions is that we just treat the spine. There are providers who just focus on that. There's more of us that treat the entire body from a musculoskeletal perspective. The most simple way to put it is, if it's a joint and it has ligaments and muscles attached to it, we can treat it. So foot, hip, ankle, knee, shoulder, elbow, wrist, fingers, toes. There are very effective treatments. And again, I think if we follow the pain patterns of those, extremity issues to the kinetic chain, there's always a cause, and the effect is the pain, right? So if we determine what the cause is, which is usually an extremity issue, you'll find the effect. I've had patients, one of my greatest accomplishments was a kid. He was a baseball player, he was a pitcher, played baseball all his life, always stuck at, 78, 80 miles an hour at 17. And he practiced. The kid was going to the gym, and his father brought him in because he was a patient. And he's like, what is wrong? Why can't he break that threshold of 80 miles an hour? So his name was Brandon. And, it took me about 2 weeks assessing this kid, twice a week. And finally, I was looking at his mechanics because I had his father videotape him pitching. He came into my office. He was actually pitching fastballs in my hallway, no shoes, no nothing. And it turned out that his foot was slightly pronated, was slightly in on that, the opposite foot. So when he loaded up his body, the body was already preloaded. So that sling, there's a posterior sling on the body. So we worked on that. We worked on that pronated foot for 6 months, and the kid went up to 87 miles an hour in 6 months.
Wow.
Without practicing any pitching, just working on the biomechanics.
Wow. That's incredible.
So that was that was one of my biggest wins. I still see him. Now he comes in for plantar fasciitis, so.
Okay. Do you have that's a great story for an athlete. Do you have a great story for maybe like the everyday person, or maybe like a really challenging case, another really challenging case that you experienced over your career that just kind of really makes, like, I guess can make the average person sit up and be like, oh wow, like that's what chiropractic care could do for me?
Yeah, the thing, post COVID, we see a lot of upper extremity stuff and neck stuff. Obviously, one of the things that I've seen more often recently is, coldness and, hey doc, my hands are getting cold. Why? I went to my doctor. It's a pinched nerve. And I'm like, okay, let's just assess. And what it tends to be is that, it's something called upper cross syndrome, where we're always hunched over, we're always shrugging our shoulders, and, the 12 to 15 muscles that are attached to the shoulder girdle to the neck are actually so tight that they're impeding the blood flow to the hand. So if you loosen that up, that tends to go away. The numbness tends to go away. We've seen a lot of people in here who say, I have to shake my hands at night, and it's usually coming from the shoulder girdle itself. That is in itself one of the most common conditions that I'll see in here at least 3 to 4 times a day.
So it's being hunched over the computer, it's being hunched over your phone.
That whole neck thing. Yeah. But a lot of people, what I like to do in my office is not only assess the neck, right, but also assess the shoulder girdle itself, because it goes hand in hand. So shoulder may be causing neck may be causing shoulder, which causes everything else going down. So it's a whole chain that I personally have this flow chart in my mind, that when somebody comes in with something, I know exactly what to look for, where to look, and what to look out for.
Okay. Now you did mention misconceptions, as far as people think that it's only back, only neck. It's not every single joint that people think of. What are some other common misconceptions do the average person have about chiropractic care? Well,
I think one of the things that I have patients come in here and they ask, are you going to crack my neck? And I'm like, well, I typically don't, in all honesty. I mobilize the neck. I do not, sit there and thrust with a high velocity adjustment on the neck for many reasons. I don't feel that everybody needs it all the time. I don't think everybody needs to be adjusted every time they're in my office. There's sometimes that, I have patients that just need a little soft tissue work, gentle mobilization, and some education, and, they could work on things by themselves. The other misconception is that, you need to see a chiropractor 3 times a week for the rest of your life. Personally, I love people. I love being around people. I love having people in my office, but I want to see different people. I don't want to see the same people in my office day in and day out. That becomes kind of mundane, not as challenging, I don't want to say interesting. It's always very interesting when I deal with patients, but you do not need to come into the chiropractor 3 times a week, for sure, for the rest of your life. What we typically do in here is that, we'll do conservative treatment for maybe 2 weeks, see how the patient's responding. If they're responding positively, we'll continue for 2 more weeks. After that, if the patient is 80% better, we introduce rehab, active rehab in my office. And I stop seeing them and my therapist sees them. So after 2 or 3 weeks of that, we always ask the patient, we always tell the patient that your body better than we do. There's always wear and tear. We know you're not going to be doing your homework. You're not going to be stretching. You're not doing your specific exercises. So find a medium or an interval where you think you need to just get a tune-up. And in the office, my office, it goes, I think, every once a week to every 16 to 20 weeks. And that's when they come in.
Got it. Thank you for sharing that. Now I'm curious, is there any new or emerging treatments that you're particularly excited about?
In our profession, I think in terms of treatment, I think they're doing research on some, but I think what fascinates me the most is that in the past few years that, back to the landscape of healthcare, there's a lot more collaboration with other providers, which is exciting. There's, hospitals, there's surgery centers, there's orthopedic surgeons, there's pain management. So what really truly excites me for the future of not only my profession, but the entire medical communities that we're all being integrated together and working together for the common cause. We've let egos kind of go, because everybody has an ego, and we've come together for the patient's well-being, because we all see it the way the healthcare system has changed. And everybody gets affected, but at the end of the day, you're dealing with the patient's health, which is something that I've never taken for granted. I know a lot of my colleagues haven't, and we truly want to make a difference.
Yeah, I think that's great. So I've been seeing a lot more collaborations. I've seen just the field of medicine opening up, and there's a lot more different options for people. So I think it's amazing that there's a lot more opportunity for collaboration, whereas before there maybe wasn't. But then that kind of also leads me into my next point here is, with your practice, how do you differentiate your practice from others in the industry? Like, what sets you apart?
Well, I think specifically for my practice, my involvement with the community is one. Being involved with the state board is another. But after 23, 24 years of practice, 22, I think, I don't know what it is, 20s, I've created some amazing relationships. And those relationships, are based on the fact that everything I do in my office is evidence-based. There's always research behind everything I do and why I do it. My relationships are very strong with other providers. So we are kind of the liaison, per se. Say somebody comes in with, a low back issue that's not responding favorably. We always collaborate with other providers. And we all have, there's like 30 of us that have each other's cell phones. We text, hey, John, I'm sending Mrs. So-and-so over. Please evaluate. Let me know what you think about, pain management, any surgery, any neurosurgery, orthopedic surgery. Let's collaborate on how we can, help her out. But what's great about our office is that we're always in the loop. There's not one person that we have in here that we are not in connection with their primary doctor, their orthopedist, their pain management. We're always collaborating together. And we make sure that the patient gets the treatment that they need. Sometimes they'll go to the provider, you need this, this, and this. Not necessarily, you may not need it. Let's just, get the best result in the shortest period of time. And that's what we're striving for always.
Okay. Now, I want to zoom in a little bit on the patient themselves. How do you approach educating your patients about what you offer, the treatments, the benefits, particularly when you're collaborating with others, kind of like you mentioned, someone may tell them one thing, maybe they do or don't. You have the network to help them. So really, how do you approach education for your patients specifically?
The funny thing is, before technology was so great, I had a huge whiteboard in my office, the old the erase things. And I literally used to have the patient, once I examined it, they would come into my office and I would draw an anatomical structure and explain in detail as to what's going on. Then I would explain what we're going to do to affect that structure that's the issue. Then we gave them homework to do, handouts in terms of general basic anatomy, general basic biomechanics, and what we are going to be doing at every session, and to the reason why. And we always ask patients to share with their families, because husbands, wives, children, they always have questions. So we welcome their significant others or loved ones to reach out to us, obviously if HIPAA compliant. So we get them involved. It's very frustrating when somebody goes home to their significant other or their family and they can't fully explain to what we said, but they always have access to us, so we make sure that family members are also responsible for the well-being of their loved one that we're caring for.
Okay, got it. So it's all about trying to make it as simple as possible to understand in a way that they explain it to others.
Absolutely.
Okay. And just curious, in your experience, how many times have you seen maybe not a misdiagnosis, but maybe an overdiagnosis of, oh, you need this, and this, when really they only need one thing? How often do you see that in your line of work?
Ironically, I had a patient yesterday who I've been seeing for a few months now, on and off, about once a week. She's a little bit, I think she's in her 80s, very nice woman, amazing shape. She's, she does yoga, she does everything, but she's had back issues since she was probably in her 20s, for 60 years. And, she does go to other providers. One of the providers insists on doing injections at the same level for the past 2 years. So this poor woman, every couple of months, she gets the injection, and finally I had to say, I'm like, I think we're past that right now. I think you're past my office. You're past with conservative care. I think maybe it's time to consult with a neurosurgeon. And, this neurosurgeon called me yesterday in my office, and he said, you're absolutely right. There's no reason why she should be going for so many injections where there's no long-term benefit at all. She's elderly, she's not as strong as she was 20 years ago, 30 years ago. So let's go on to the next level and just forget about all this other stuff, let's just get to the root of the cause.
Wow. So
a lot of underdiagnosis or misdiagnosis also we've had, which is, in pediatrics, scoliosis is number one. It's crazy how, a child can have a 15 to 20 degree curve and not knowing till they're 18, 19, 20. I'm working on several, senior citizens right now who are in their 70s and 80s. And, you look at the MRIs of an undiagnosed scoliosis at teen level at 70, 80, there's very little you can do. And it's just sad. It really, truly is sad. Because this could have been preventative, if it was addressed appropriately back, 50 years ago.
So what role do you think creativity plays in how you approach patient care? Because it sounds like from the stories you're telling, like there's all these different types of situations, but the other school of thought is, well, it's medicine. There's always a process, there's a procedure. So, how do you combine those two approaches? How much creativity goes into this?
You're right. You're absolutely right. I think it is a process, right? We all have processes, but every patient is not the same. You can have 3 patients with the same symptom, same pain, same location, with 3 different causes. And I think we need to, as a medical community, a healthcare community rather, we need to open, our thought process a little bit and approach it a little bit different. Just because you have a hammer, it doesn't mean everything's a nail. We need to collaborate together. And I think every healthcare specialty has its niche. Thankfully, I fell in love with biomechanics since I was a kid. Essentially, I always wanted to know why the shoulder moves the way it does, why the toe only flexes and extends. I always had a passion for it. And luckily, in high school, I loved physics. I never had to study for physics. In college, I never had to study for physics. So I kind of combine the two together, because essentially, movement is physics. So, and I think that's where we should focus on. One of my good friends, he's an orthopedic surgeon, and over dinner a couple of months ago, I'm like, why is it that people need a new knee or a hip every 10 years? And he goes, well, maybe because wear and tear. I'm like, why? He's like, well, titanium, and it's stronger than bone, so therefore. I'm like, what if the knee or the hip wasn't the issue? What if it was the foot and nobody assessed the foot? We replace a knee or a hip, but yet the foot is still, biomechanically, not perfect. Don't you think that could be a cause? And he's like, oh my God, I never thought of that. He's like, I've been doing this for 20 years and I've never thought about that concept. So now, in the past year, he does not do any knee surgery or hip surgery unless the foot is biomechanically sound.
Interesting.
So I assess the foot before he does any of the hips or knees. And, his outcomes, it's too soon to find out, but, I'm hoping that the outcomes will be a little bit more positive and longer lasting. And I think that collaboration like that, I think, is what patients should have access to.
Amazing. I think that was an amazing explanation of how to use creativity in a way that most people wouldn't think about medicine. Now, Dr. Andreas, where do you think the future of chiropractic care is going?
I think, the landscape of healthcare has changed drastically. We're focusing on prevention, which I think is amazing. I think, it's easier to prevent than to treat. It's easier to prevent a heart attack than to have an open heart transplant. It's easier to, prevent abnormal wear and tear on the knee than do a knee replacement. I think that mindset and that philosophy is coming together, and we have a place in the actual healthcare system, which we see a lot of now, especially in New Jersey. There's multidisciplinary facilities who are actually having chiropractors, PTs, acupuncturists on staff for that purpose, for the assessment, for the, prevention. And if that doesn't work, obviously go to the other side of, healthcare, more invasive side.
Okay.
It's a bright future. I do go to my alma mater, and I speak to these kids that are coming out. It reminds me when I was a young grad coming out, I didn't know much, and there is going to be, I think the next decade will be great for all providers, because I think we've embraced each other's abilities.
Okay, that's awesome. That's great to hear.
It's positive.
Now, Dr. Andreas, I have one last question for you, but before I ask it, I want to point people to your website at www.alternativechiro.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who's thinking about going to see a chiropractor, but isn't sure which one to choose?
I think obviously everybody should, do their research. That's the number one thing. And you need to find a provider who listens, who is involved, who asks a lot of questions. I typically, in my office, I don't bring anything in my office. I have a little recorder. And I always focus on the patient. I don't sit there and write, because that takes away from the story, right? And I think if we sit there and we write too much, we may miss something that's very important, a flag or something. So always find a provider who will spend time with you, especially on that first visit. A provider who actually explains everything to you before they do anything. Make sure you understand what's going on with your body and why it's going on in your body. And, you have to feel comfortable. That's it. You have to create a rapport, because we are a big part of, your well-being.
Okay. Well, there you have it. Dr. Andreas sharing his expertise. So Dr. Andreas, where can people contact you in your practice?
So we are in Clifton, New Jersey, 1011 Clifton Ave. We're on the first floor. And our phone number is 973-779-2466. Our staff are always available to assist in any way.
Okay, great. Well, thanks for being on the show and sharing your message.
Thank you, Daniel. Appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.